Yes, I believe you can do so, Lord.
This is another day the Lord has given to us to enjoy freely, but not all people have gotten this opportunity. But today, if you are alive and well, let's give thanks to the Almighty Lord. Another day the Lord has given to us for us to discuss a very important topic. In fact, this is something that we've been uttering for a very long time.
Lord, I believe that you hear.
We are here with our guest, very beautiful woman,
Father,
doing the work of the Lord.
Lord,
This is another gospel,
that you heal.
propagating the gospel according to public health nurse. Today we are discussing a very important topic, that is immunization and its importance. We have been always going to the hospitals when we give birth to our children. We have been giving them some immunizations, giving them some injections. Sometimes we give them some drugs to take in. And we don't normally know the importance of it, why we should go for it. And we are making it just norm. We have to go there for it. And today we have a very beautiful lady to discuss with us why we should go for these immunizations. If you just join us, we are live from Sisa Ghana Online Radio, live from Adunfie, and my name is Isaac. And we are in the studios with our producer, Mr. Andrews, and his counterparts. Let's spend some few minutes, let's say seconds, about 30 seconds, to share the links and then also try to prepare ourselves to listen to this important news. And then right after that, we introduce our guests. So let's go and come back. We are all welcome back. In Akan, you say, Ochami Onimo Asem can also with Nana Wasumwa. So please, you introduce yourself and where you are coming from.
I'm Priscilla Edu Aduma, a public health nurse from Hope Exchange Medical Center.
All right. You've heard it. And you can also join us on all the social media platforms. And we are yet to start. You are welcome, sister.
Thank you very much.
Yeah, today, as the topic says, immunization and its importance. So when we say immunization, what do we mean by immunization?
Okay, immunization is the process of making a person's immune system effective in fighting against diseases. So once someone is immunized, that makes the person's antibodies active against particular diseases.
Oh, okay. So in the process of taking
making a person immune to an infectious disease.
Oh, okay.
Yeah.
So what is the difference between immunization and then vaccination?
Okay, without vaccination, you cannot be immunized. So the vaccination is the process of introducing an antigen or a substance that will make the person be immunized against a particular disease. So it's two things. You cannot be immunized without taking a vaccination. Sometimes you get immunity from a particular disease infection or pathogenic infection, like let's say the chickenpox. Once you get it, you become immunized. But 90% of immunizations is given through vaccination.
Oh, okay. Nice one. So there are some that we can get whilst we get sick.
When you are infected with that particular diseases, you become immunized. The body become immunized against.
Oh, okay. And disease. Then the other ones is the one that you have to give the injection.
You have to give the injection before you can be immunized. Yeah.
Oh, okay. That's good, because for all this, I was thinking that unless you go there for them to give you the injection or give you any other medication.
Not all. We have some particular diseases that you get them and the body's immune system protects you against it for life.
Okay, like the one that you talked to us about.
Like the chickenpox.
Okay, yeah. And then measles too.
Measles, we have vaccine for measles.
Okay.
Yeah.
All right. So do you have types?
Yes, we have various types of. When it comes to types, we have it in forms. We have
Okay.
the live attenuated vaccines. We have inactivated vaccines. They are not live. We have the viral vector. We have the toxoid vaccines.
They are the forms.
Yes, they are the forms.
Can you explain to us so each of the type?
Okay. So the inactivated ones are the vaccines that you need to take more before the immune system will be immunized. Yes, and with the inactivated ones, you cannot just take a shot and say you are immunized against that particular disease. And we have some in Ghana. We call the inactivated polio vaccine.
Okay.
Yes. You cannot just take one and say you've been protected against that disease. And we have the life attenuated ones. That one you take 1 or 2 shots and you are free for life. And we have the toxoid vaccines, like the diphtheria and the tetanus. They are those ones you wouldn't need to take, let's say, for life.
Okay.
You have to take it once it comes, or once the need arises. You have to take those vaccines, yes, to protect you against those ones, like the tetanus vaccine. Yes, you cannot just go and say you've taken a tetanus toxoid vaccine, so you are free for life, and you have to
Still go back
yes
there.
you still have to. And we have the viral vector vaccines, like the COVID-19. Yes.
Hey,
that one is-
COVID-19. Okay, I've taken
Yeah,
some.
you've taken
I
some.
was about to ask, hey, COVID-19 have vaccine?
Yes, COVID-19 has a vaccine. And that one, you cannot just take one and say you are immunized. Initially, scientists thought they can give just one shot for you to, but later they realized you need extra. They even give booster. So if you've not taken 3,
I've
that
taken the
means-
3.
Yeah, okay.
Oh, that's good. So that's the difference between the vaccination
Yes,
and the
these are the forms.
immunization.
Yes, and the types in Ghana, we have about 15 vaccines that we give.
We will come there. So let me tell So if you just join us, we are live from Adolfie, and we are discussing immunization and its importance. And you can join us on all the social media platforms. Our guest is Priscilla Adu Aduma, PAA. Or you can still do it PA. That is Priscilla Edu Aduma in short form. He's a public public health nurse at Hope SJ Medical Center. And then she's here to discuss with us the importance of immunization. And because we've been going to the hospitals all the time, taking vaccinations, doing a whole lot of things, but we don't understand. Today, he's here to talk about it and then explain to us why we should go and the need for us to go. So, sister, you were saying something. So you're about to tell us some differences, so we are listening.
Okay, let's take the vaccine, how it works. Vaccines do train the immune system to recognize and fight a pathogen or prevent a particular diseases. And immunization do saves lives. Millions of lives are saved.
Before you continue, it means that we take the vaccination or the immunization before the sickness comes, but rather not the sickness should come before we take it.
No, you have to take to protect you from the disease or the.
So you take it and the body will build the immune system.
The immune system.
Okay.
Yes, the immune system will be trained against that particular disease in case you get infected. Sometimes people think when you take a vaccine, you shouldn't even be infected with that particular disease that you've been vaccinated. But you can't get the infection, but the severity. Someone who hasn't taken the vaccine may die from that, but you who have taken the vaccine will not die. You may fall sick, but the severity compared to the one who wasn't vaccinated or immunized against that particular disease, yes,
will be more.
Yes, you are protected, even though you'll be tested positive, but you have protection against it. That is how vaccine immunization and vaccination works.
Oh, okay. That's good. So you're talking about the forms.
Yes, the types. Ghana, we have about 15 types, but currently the Public Health Department of Ghana is running just 11. And with the 11, only 9 is run in Ashanti region. Yes, that is the polio vaccine, the penta, the pneumococcal, the inactivated polio vaccine. We have measles, yellow fever, meningitis, BCG, and tetanus. These vaccines is given in the northern Ghana, Ashanti region, Greater Accra, and they have this malaria vaccine.
The northern Ghana, Ashanti region, Tamale,
No, Northern Ghana. Is Tamale part of Northern Ghana?
Yes.
Okay, then no.
So it's divided into
Three.
Three.
Yes.
The middle bits, the northern bits, and then the southern bits. Oh, okay.
Okay. Then some parts of the northern region do give the malaria vaccine.
Oh, okay.
Yes. I once asked why Ashanti region wasn't given malaria vaccine and Greater Accra wasn't given, some parts of Eastern region wasn't given, and they were saying places that they see literacy, high literacy, that means they know how to protect themselves from the malaria very well. So they are not given, because the malaria vaccine is really expensive and the government cannot afford for everyone. Yes, so those who can read well and are knowledgeable about malaria, they don't really need it. So they've taken it up there, and they normally take it to where they have this sorry to say, poor sanitation. Yeah.
Poor hygiene.
Poor hygiene. I didn't want to use the hygiene because yeah, it will feel, yeah.
Oh, okay. So you are polishing it.
Yes, I'm polishing it.
All right. So with the types of the vaccination or immunization.
Yeah.
So when are we supposed to take them?
Okay, we have the polio vaccine and BCG. Polio vaccine should be taken 4 times. So once the baby is born, the day that the baby comes out, that's the ideal day that we should give the polio vaccine and the BCG. Yes, the BCG is going to protect the baby from tetanus. And we know how tetanus is. And tuberculosis, rather, sorry. We know how tuberculosis is. The virus or the variants are around. As we speak, we can feel them, but you cannot see them.
Yes.
So if you wait for the baby
microscopic.
to grow, yes. If you wait for the baby to grow before the baby is protected from the BCG, yes, that means the baby may get the infection before the vaccine is being introduced. And once the infection is there, when you introduce the vaccine, you worsen the case.
Okay.
So BCG ideally should be given the day that the baby is born, or at least within the first week when the baby comes out. But because of how BCG is, it's very, very small, and it comes in 20 doses. And you have to give 0.05 to one baby.
Okay.
And when you open this vaccine, it shouldn't last for more than 6 hours. So how are you going to give this vaccine to each child on the day the baby is born?
Maybe we can go around and ask people, so please, have you given birth today? Then we bring them all together.
You are not paid to do that. We are not paid to do that. So normally we do group babies and we give it to them so that we wouldn't be wasting the vaccine because it's really expensive. Yes.
With that one, are we doing more good than harm?
That's the problem. Oh, that's the problem. And when you go for workshops, they will tell you that you should give. Even if you have one baby, you should open it and give and discard the rest. But the following time you go and they will tell you, you are wasting the vaccine. What's wrong with you people? Why are you wasting the vaccine? So we do educate the mothers on how to protect them from these tuberculosis or airborne diseases, so that within the 1 week frame that we've given the babies, I'm talking for Hope Exchange Medical Center in Kwadasu District because that is where I work. But I know with the higher facilities, the bigger hospitals, they do give every day. But I don't think they give on weekends, but they do give every day because they have delivery more than 20 every day. If you go to Confanoches in Treso, I know they get deliveries more than 20 every day. But Hope Exchange and Kwadasu vicinity, I don't think any facility gets more than 20 babies a day. So we do group. But before then, we do educate the mothers so that they will know that anyone who has cold or someone who is coughing shouldn't come closer to the baby for now. Yes. Then after we give. And when the baby is 6 weeks, then we start giving the penta. The BCG is given at the right upper arm. And that is
is it the one has given us all the marks?
Everyone has the mark. That is the African mark. The time will come when you are traveling and don't have the mark. They know you are not an African. You have to go back. Yeah. It's given at the right upper arm. Yes. Every child has it.
Yeah, mine is there.
Yes. It should be there.
Yes, I have become obolo, so
it should be there. And the OPV is an oral vaccine that we do give. It's going to protect the baby from polio. And as I said, it's given 4 times. The first one should be given to the baby before the baby is 2 weeks.
Okay.
And the OPV2 comes in 20 doses. But then that one, when you open it, it can last for 28 days. Depending on how you keep the potency of the vaccine. So that one we can give any time. Immediately the baby is out. When you call, we come, we give the baby. Yes. So when the baby is 6 weeks, that is when the problem starts. That is the immunization mothers don't like. It's very painful. The penta,
the one that you always cry for.
Yes, because it's going to protect the baby from 5 diseases: diphtheria, pertussis, tetanus, Haemophilus influenza, and hepatitis B. So
Again, repeat it again.
Diphtheria,
Diphtheria,
pertussis, tetanus, Haemophilus influenza B.
Okay.
Yeah, and the hepatitis and hip, Haemophilus influenza. Yeah. And that one is very painful. It's given at the left thigh. It's really painful because it's 5. I don't know if you remember. I don't know if you took this vaccine, the H1N1 vaccine.
Yes. Every vaccine that comes,
You do take.
I take it.
It was very painful. It was
Yes.
really painful. So I was saying, Ash, so this is the vaccine that we've been giving to these children. It was really I got sick for more than 2 weeks. I couldn't go to work. So that is how the penta is really painful. And the effect that comes out is maybe the site that the vaccine was given becomes reddish. Sometimes it do swallow, but that one shouldn't be a problem or a cause for an alarm. And the babies too may get fever after taking this vaccine.
Okay.
All immunizations have effects, but penta's effect is really outrageous.
Maybe
Yes.
because of hepatitis B vaccine.
B vaccine is not painful. No.
Oh, I took one. It was very
It was
painful.
very painful. It shouldn't be. It shouldn't be. It's because it's 5
In one.
It's 5 vaccines combined, and it's really painful. And that same day, the baby is going to take PCV to protect the baby from pneumococcal pneumonia. That one is taken at the left thigh.
The same day
The
that you
same
gave
day
the.
that we've given the penta, the 6 weeks. You
Why?
have to- that is the schedule in Ghana. I learned in other countries they don't do that. They do it, let's say, every 2 weeks or every 3 months.
So you take maybe the D.
The DPT. And even I realized the DPT in Europe is not 5 in 1. They have some that is just 2. That is just like they have vaccine for pertussis alone.
Okay.
But in Ghana, pertussis is added to tetanus, diphtheria, hepatitis, Haemophilus. I don't know if you get me.
Yeah, I get you.
But in the Western world, they do have it in forms, but normally it's not more than 2. So
Okay.
it's not painful
As compared to the one that we take here.
Yes, that we take here, because we are less privileged, and they do sponsor us with the vaccine. And when they say they cannot make it separate and they have to combine, we don't have anything to say. Our children, they need to suffer, and at the end gain.
Or is it because that the kind of diseases or the kind of condition that the weather here
Yes.
is different from the one that they have there?
Not necessarily the weather, but I think the vaccines are being produced or sent to a particular country or region depending on how the country is, like, let's say the sanitation that I said.
Oh, okay.
Because there are some vaccines that we take in Ghana, they don't take in the Western world. When you have to take malaria vaccine in Europe, you will take yellow fever when you are coming to Africa.
Yes.
You will take malaria vaccine when you are coming to Africa. I don't know if you get. Yes, you
But
take.
here we take the yellow
We take
fever and
yes,
walk
by hook or
around.
crook, you have to take yellow fever because yellow fever is with us, but it's not there. Yes, so it depends on the pathogen, where the pathogen is, the origination of the pathogen. That is where we take that particular vaccine. So
Okay.
if they don't have, they do have mosquitoes, but they don't carry Plasmodium falciparum, so they don't need a malaria vaccine. Yeah.
Africa,
Yes, Africa.
where we were born to. Nice one. And then the another form.
Yes, so I was talking about the 6 weeks.
Yes.
The babies who take pentavalent vaccine. The one I said is 5 in 1 is very painful at the left thigh. And that same day, they will take pneumococcal at the right thigh. Pneumococcal is going to protect them from pneumonia. And they will take another polio vaccine. That one is oral
Oh, okay.
to protect them
That
from...
one is the sweet one.
No, the sweet one is the rotavirus. The rota is very nice. Yes, and polio, you just give 2 drops to the baby to protect the baby from polio. And the rota, you give 4 to 5 drops to protect the baby from rotavirus.
Okay.
And the rotavirus do cause diarrhea. Yes, so we educate the mothers to protect them from diarrhea. Yes,
Okay.
some form of diarrhea. Yes. So when the baby is 10 weeks, that is 4 weeks after the baby has taken this painful immunization, we bring the baby back and we repeat it.
The painful one
The
again.
painful one. Repeat all the 4 vaccines again.
Oh, wow.
Yes, really painful. And the worst part is when the baby is 14 weeks.
After this painful one, there is another worse
Yes,
one ahead.
when the baby is 14 weeks, then when we give 2 vaccines at the right eye, that is the PCV, the pneumococcal, and we have IPV. IPV is a polio vaccine, but this time it's an injection. Remember, I said we have inactivated ones and we have the activated ones.
Yes.
So they brought the IPV, the inactivated ones, to support the activated polio vaccine that we do give the oral.
Okay.
Yes, so this inactivated is given at the right eye with the PCV when the baby is 14 weeks. And at the same time, at the left, the baby is going to take the Penta, the 5-in-1 too.
Wow. So
Yeah.
the pain idiot.
Yes, they go through pains.
Okay. In fact, if you just join us, you are live from Adolfia. We are discussing immunization and its importance. And we have limited ourselves into Ghana
You're a healer.
because we are in Ghana.
Yes, I believe you can.
And then we are live from all the social media platforms. Especially, you can join us live from YouTube and also Facebook. And we are live from Adonfie, Sisa Ghana radio station. And our guest is public health nurse from the Hope SJ Medical Center. And she's here. In fact, Ochirichiri Mwangasa. The need for us to do it and why we should do it.
Father, heal me.
So please, if you just join us, you can also share it. So please, let's continue on our talks.
Okay, so after the baby is given the 3rd dose of the vaccine, of the Penta, the polio, the PCV, and the rest, the baby will relax, will rest small. When the baby is 6 months, the baby do take vitamin A. But vitamin A isn't an immunization, it's a supplement
Oh, okay.
that we do give to the babies to protect them. Yeah, eye, yes,
Other forms of
retina,
disease.
yes.
And it also helps them with the eye.
Yes, it helps. It's a supplement that we
Okay.
do give. Yeah, it's not really necessarily
For
a vaccine.
immunization, okay.
Yes, that one is normally given by the nutrition officers, but it's part of the immunization
schedules.
schedule for for Ghana.
Okay.
And now they've just, let's say 3 months ago, they've introduced IPV again to be given to the babies when they are 7 months old.
That painful
That
injection.
no, IPV is not painful. It's not
Okay.
that painful. The one that is given plus the PCV at the right time.
Oh, yes.
Yes. When the baby is 7 months, the baby will take it. It just came, so some mothers are not aware.
Okay.
Yes, it just came. Let's say barely 3-4 months ago.
Then let me tell the public that, in fact, this is a new news. Every news is new, but this is a new
New
news.
news.
Let's sensitize this and then inform our various children or various mothers who have
Caretakers.
caretakers who have children, that when you have a 7-month-old child in the house, you can still send the child to the hospital for this kind of vaccination, the IPV. In fact, it is a new thing that they've just introduced, and it's going to help us because of the, before they will introduce something, it's because of the investigations and then the evidence that they have. Research have gone into it and the importance of it before they introduce it. So please, if you have a child who is 7 months old, you can send this baby or this child to the various facilities for them to immunize them. Thank you. And please, let's continue.
Okay. So after the baby has taken the IPV for 7 months, when the baby is 9 months old, the baby will be given measles and yellow fever
Yeah,
immunization.
that one there. I remember that one too is painful.
It's
Yes.
not painful. It's not that painful because the baby has already taken the Penta, which is very painful. I consider these ones as less painful because the Penta is really painful and the babies go through a lot when they take pentavalent. So the measles and the yellow fever is given at the upper arms. Measles is given at the left and the yellow fever at the right upper arm, where we give the BCG. We give them yellow fever when the baby is 9 months. Yes. And after 9 months, the baby is also free. We are talking about the, let's say, Ashanti region. But in other regions, after 9 months, the baby is not free. When the baby is 1 year, the baby will go and take the malaria vaccine. I think they do take it at 3 months, 8 months, 1 year. They do take 3 because we are not giving. I'm not familiar with
Yeah,
that.
Buronga half region, the Bono region,
They
Bono
do
East,
give.
yes, they
Yeah,
give,
they
and
give
half they are
malaria.
parts, and then northern
Yeah.
parts of Ghana is
Yes, some.
they also part.
Yeah,
Some of them,
yeah,
yes.
they do give. But here in Ashanti region and Greater Accra and some parts of Eastern region, we don't give.
Okay.
So we wait till the baby is 18,
18 months.
That is 1 year, 6 months, 1.5, as many of us know. There, the baby will be given the last dose of immunization.
Injection.
And, yes. And that one is a repeat of the measles at the
okay.
left upper arm. And the
And that one you said is
meningitis.
not that painful.
It's not that painful.
Okay.
It's not that painful, yeah. And we have immunization for pregnant women, like the tetanus.
Before we come there, I want us to repeat the ages or when and when we are supposed to go for the immunization.
Immunization.
So the day that the child was born, within the first 2 weeks.
Yes. Within the first 2 weeks. And when the baby is 6 weeks,
Okay.
where we normally say 40 days.
Okay.
You take 4 immunizations, 2 injectables, 2 orals.
Okay.
When the baby is 10 weeks, 10 weeks is 2 months, 2 weeks.
Okay.
You repeat what you took when the baby was 6 weeks.
Okay.
4 immunizations, 2 injections, 2
2
orals.
orals.
Yes. And when the baby is 3 months, 2 weeks, that is 2 months, 3 months, 2 weeks, sorry.
Okay.
That is 14 weeks. The baby will also be given the same dose that the baby was taking, already taken when he was 6 weeks,
That is
10 weeks, 14, yes.
2 injections,
Injection,
2
2 orals. But when the baby is 3 months, 2 weeks, that is the 14 weeks. There, the baby will be given 2 injections, 3 injections, 2 orals. I don't know if you get it.
Yes.
3 injections, 2
2
orals.
orals.
When the baby is 3 months, 2 weeks.
Okay.
Yes, 2 injections at the right, 1 at the left.
Okay.
Unlike the other
Other
weeks that the
ones,
baby was given
then
just
only
2,
two.
yes, only 1 here, then 2, yes. Here the baby is going to be given 2 at the right, 1 at the left. So when you go and they don't give the baby that you ask, maybe they are
Oversight.
yes, or there is shortage. Yes,
and they will
of that.
schedule you for another
Yes,
time.
they will schedule you to come for another time. And with this all immunization, let's say the BCG, the baby can take this immunization before the first birthday, before the baby is 1 year.
Okay.
So if the baby wasn't able to get it when during delivery or after delivery, the baby can still take it until the first birthday. After the first birthday,
You cannot take it.
yes, scientists says if they take, there is no
It's not going to work.
yes,
Okay.
yes. But with the penta, the baby can take it till the baby is 5 years.
Okay.
No 5 years, yes. With the rest,
Because I was about to ask that in case I missed them.
you miss it, the baby can still take it. You remember we have this religion that they don't give immunization. So yes, we have it in Ghana. They don't take immunization.
Really?
Yes. So when I came to Hope Exchange, I had one mother. She was with that religion, and now she says she's no more part of the religion.
Oh,
so she
okay.
wanted us to give.
Start everything.
So I asked why. He said, no, now I'm not part of that spirit that protects them from.
Oh, okay.
She thinks
that's
she's-
our religion.
Yes.
So, yeah, spiritual aspect. We,
Yes.
we believe in it.
Yes.
All right.
So she came and the baby was 8 months. So the baby had to start all this immunization. Yes, the BCG, the polio, yes. But the rota, you can't give the baby when after 6 months. You
months.
can't give
Okay.
rota to the baby after 6 months. And I think with the polio 5 years, penta 2 you can give, measles you can give, meningitis you can give. It's only the BCG and the rota that you
Okay.
can give. And the PCV too, they said you can't give. Initially they were saying you can give, but now they said you can't give after 8 months.
So at the PCV.
The PCV, the pneumococcal.
Yes.
The one that is given at the left. The right thigh. The
Okay.
right one. That one I said is not that painful. The one that is going to protect the baby from pneumonia.
Yes.
After
oh.
8 months, you can't.
You can't take it.
Yes, you can't take it.
Okay. So, in fact, if you just join us, we are live from Adonfie, Sister Ghana Online Radio, and then we are discussing immunization and its importance. And it's very important that you are listening to us because day in, day out, you are giving birth. day in, day out, we are giving birth to most of the children, the beautiful ones. They say they are yet to born. So in fact, we need to protect them before the last days comes. The last days, you understand the last days that I'm talking about. So please, let's do well to immunize our children, giving them to protect them from the various kinds of diseases and then dangers that may associate with children. We just give them these vaccinations to protect them, to help them build the immune system, to fight against all the deadly infections or deadly diseases that may cause trouble for us. So if you just join us, we are just discussing this important thing. And then we have our guest, Sister Priscilla Edu Aduma, aka Pa Priscilla Edu Aduma, PAA. Sister, let's continue.
Okay. So all this immunization we are talking about, all these vaccines are given to the babies before 5 years. And we do have vaccines that we give to pregnant women. That is the tetanus. It's going to protect them from tetanus. Let's say during the olden days, pregnant women used to have tetanus because we weren't having enough facilities where they can go deliver. It was the TBAs and sometimes a trained person, not normally trained, they are being trained by TBAs. Yeah. And every family has its own TBA,
traditional birth attendants.
Yes.
TBA.
And yes, they don't sterile their items. They just take the scissors, the cuts they do. So they were infecting the mothers with tetanus, especially, and the babies.
It's still happening because with last week, I saw 2 patients, a referral from some area. I'm not going to mention the area. A referral that they had tetanus through birth. So it's still there.
Wow.
It's not an
the babies had tetanus through birth.
Yes. And then the mothers too. For the mothers, I couldn't confirm that the DS is also with the tetanus or not, because
they may also have.
Yes.
They may also have.
And they refer both parents and then the children.
Babies. Mm-hmm. Yeah, it's there, but the ratio,
it has gone down.
Yes, it's gone down as compared to.
And we want to eradicate everything from the system.
But tetanus, I don't think we can eradicate tetanus from Ghana.
That's what I'm saying. We try.
We are trying, like the polio.
Yes.
We're trying our best to eradicate. I think Ghana has been polio free for the past 5 years. Yes.
For this very long time that you started.
It's possible. It is possible we can do it. So we give tetanus to the mothers. It was given after the mothers has experienced quickening, but they realized it wasn't helping.
And quickening, is it not 20 weeks of gestation?
Yes, when the baby starts kicking. Yes, that is when. Yeah. But you get some mothers, they will not even tell you when you ask them, because it's not visible.
Yes.
You have to ask the mothers. It's a symptom, and you ask and they, Madam, I don't know.
Especially those who are pregnant for the first time.
Yes, they don't know. So you wait. By the time you realize the mothers are 8 months, 9 months, and they haven't taken this vaccine. And this tetanus, you have to take it at least 3 times before you get protection for just a year.
Yeah. So the one that I've taken, I have to go and take it again.
Yes, with the tetanus, you have to take 5 times to be protected for
this painful thing.
Yeah, tetanus, yes, it's painful. Yeah. Tetanus is painful, and they've added diphtheria to it. So now it's tetanus diphtheria that we do give to the mothers.
Oh, okay.
That one is painful. I do react to it, so I don't.
Yeah, I took one.
It's painful.
Didn't go well.
Yes. Before you can be protected for just a year, you need 3 shots.
Wow.
Yes. So now, Ghana Health Service has made it mandatory that immediately you see the pregnant woman, the day that the pregnant woman comes to you that I'm pregnant, the pregnant woman should start taking the tetanus.
Okay.
Yes. So with that, you can give 3 shots before the baby is out. Let's say and the first one is given the first time that you see the mother, irrespective of the gestational age.
Okay.
You have to give. And the second dose is given a month after the first one. So when the mother is giving the second dose of it, it's going to protect the mother for just 6 months. And 6 months after the mother is giving the second, the mother has to come for the third one to protect her for 1 year, just a year.
So anytime you get pregnant, you're going to experience this kind of shots.
Yes, but the number of pregnancies that you've had will determine the number of
Shots you are going to get.
shots you are going to take. Because let's say you delivered 2 years ago and you took all the 3 shots. That means you're going to start from the 4th and 5th.
Oh, okay.
Yes.
Okay. So once you're able to take all the 5, it means your
all the
subsequent
5.
ones you're not going to take again.
Yes. If you take
Okay.
all the 5, you're not going to take again. You should not take
Okay.
again. But you may be given boosters to protect you. The booster there, you still have to. Yes.
Okay.
Yes. So pregnant women also have vaccines that they do take. But many of them don't know they have to take immunization. Yes. So we are by this informing pregnant women that you're also part of immunization. So whenever you are pregnant and you go to the facility, ask of it. They have to give, and it's given at the left upper arm. Yes, where we give the measles.
And we those who are not also pregnant and we can't get pregnant, can we also go for immunizations?
Yes, you can come for the tetanus toxoid.
What about the pneumococcal ones?
The pneumococcal, no, is for the babies. The pneumococcal is it's just for the babies. The adult one is the tetanus that I'm talking about, and
maybe
yes,
Hep B.
Hepatitis, there is a voluntary immunization that you want.
And the yellow fevers.
The yellow fever too, you can't come. But you see, as I said earlier, Ghana don't have money to buy immunization for everyone. That is why they've set it aside for just the children. Yes, like the tetanus diphtheria. I was asking, the men need it most than the women, because the kind of rigorous work that they do, they easily get injured with this, so they need it. But one of my supervisors said, hey, we cannot buy for the men. Oh. We are protecting the children, so we have to give to the mothers when they are pregnant. So if you come genuinely that you want to be immunized against tetanus, we will give you.
Men, please, let's go and then tell them that we need it genuinely, because our lives matters. Because if we don't protect ourselves now and we get sick or we get let's say injured, or when we die, it means that these children are going to suffer. Yeah. The one that you are trying to protect will still suffer. Yeah. Because how you want to take care of these children, those there are not going to do it the same way that you do it. So please, we beg you, go there for the immunization. Though it's sometimes, tickle, a bit painful, but it will be better you experience that pain to protect yourself and live long, rather than to cut your life short.
Yeah.
So we beg you all. All right. So and let's go to the importance.
Let's add this. We have a vaccine for rabies.
Now rabies vaccine is there.
It's not free.
Oh, okay.
So when you get a dog bite, you have to go for it. And the rabies.
That one, do you have to get the bite before you go?
Yes.
Oh, okay.
Yes.
I thought we made it in a way that I can also walk in and say,
rabies isn't like that.
Oh, okay.
When you have to be exposed before. Yes.
All right.
If you are not exposed, you cannot just go and say, I want to protect
how long should we wait when someone is being exposed to the rabies? How long should we wait?
No, you shouldn't wait. Not less than 1 week. You should start with the shots. You shouldn't be more than. Yes.
Then immediately you get exposed. When you have a dog bite,
yes,
a cat bite, any bite, even sometimes human bite.
Yes.
You need to go for the shots. For the human bites, they are not part.
Yeah, they are also part because that one too. They said that one you can get tetanus. I learned you can get tetanus. But I was like,
yes. When someone bites, you can
what
get
does
tetanus.
the person chew? But scientists says you can get, so we follow them. They are learning.
But we also learning.
Yeah, we are reading. Are you sure we are learning?
Yeah, we read.
Everything is done by them. Yes.
Okay.
So the importance of immunization, once you are protected from a disease, you don't fall sick.
Okay.
Yes, and your life is being saved. Yes, and we have something called the herd immunity. Herd immunity is, let's say, those religions that I said they don't take immunization. When other religions, we are more than them. So when majority of the children are being immunized against a particular disease, it do protect those who don't take too. Because
I remember with the COVID-19 time, they said most people were immunized. So because of that, if the rest are not being done, and we are safe.
We are safe, yes, because majority have been immunized against it, and when they go and they are exposed to the diseases, they can't carry it back to the country. So that means if you are not immunized, you are protected, and that is the herd immunity. So immunization is very good, and it's economic benefit too, because the cost of healthcare,
the vaccines and the rest.
no, we are talking about the importance, and I'm talking about the
okay.
cost of healthcare.
Okay.
Yes, vaccine is cost effective because if you are protected from a particular disease, you don't get sick, and the burden on the government to
Also
provide,
goes down.
yes, it goes down. So it's economic benefit for both the government, and it's a public health security too. Yes,
Okay.
especially during pandemics and epidemics, outbreaks. When we have a vaccine or we are being immunized, it makes the public
Please,
calm and
and
stable.
not that because he's saying that if the masses have gone for the vaccination, you are not also going. You are going because you don't know the one close to you.
Yes.
Either the person have gone for it or not. And besides, the person can go for it, and then the person will be a carrier. You, the one who haven't been vaccinated or immunized, is going to contract the disease,
Yes.
which is going to cause problems.
Yes,
So
it's
please, it's the problem that we don't want you to cause. That's why we are saying we beg everyone should go for the vaccination.
Yes.
And for the children, you have no excuse.
No.
We have to send them in there because they are government properties and they are all for us, though having given birth to them. But yes, they are still for us all. So thank you for listening to this information. So Icy, please, let's continue.
Yes. So to add up to what you said, I said earlier that when you are immunized against a disease, it doesn't mean you are not going to have that disease.
Exactly.
Yes, you can have it, but the severity
Goes down.
yes, it goes down. So don't say you are waiting for others to get it so that you get the herd immunity. No.
Let me add this: the chances of your survivor is higher
It's
than the
higher.
one who haven't gone for it.
Yes, it's higher. Yes. So even if you've taken it and you can still get the disease, then you should know this is it's something that you shouldn't play with it. Once the vaccine comes and it's free, you have to. Even if it's not free, you still have to. Ghana is coming to introduce a vaccine, the human papilloma virus
Yes,
vaccine,
yes.
and we are starting on the 4th
4th of October.
4th of October. We are starting the campaign, and
Okay.
the real deal is starting on the 6th
Okay.
of October.
Then I'll be inviting you here
7th.
to talk about this when it comes.
Yes, when it comes. We haven't been trained on how to give it and the site, and then that is why I didn't say much about it.
Okay.
But we are coming to
I
give.
said when it's time.
Yes.
I'll invite
And
you.
it's a privilege too, because the human papilloma vaccine is 2,800 for one shot, and you need 3 shots.
Wow.
So once the government had decided to give it to the girls for free, and it's only for the girls for now, for free. Ladies from
Okay.
the ages of, they said the ages of 9 to 14 years.
Okay.
Yes. So when we come to the houses to give, please, mothers, give us the chance to give.
So the importance is clear now that you protect yourself against diseases, and also the diseases is not just disease, but rather sometimes it causes death.
Life
So
threatening.
we are preventing childhood death. In the olden days, a lot of people die from childhood diseases.
Yes.
But because of these vaccinations and then immunizations, the diseases occurrence are now reducing.
Yes.
And we want to reduce it totally. Total reduction is what we want to do in Ghana.
Yeah.
So please, it's very
Eradication.
important. Yes, eradication. So it's very important that you come and then you do vaccinations. If you not come to Hope Asian Medical Center, you can go to Suntreso, any other facility close to you. Even sometimes they come to your homes.
Yes.
To we don't want to burden you. They come to your homes to give you this kind of vaccinations and immunizations. Please, let's welcome them and then give out to our children so that they can live for long. Thank you. And I see. I'm calling you Icy. That is in charge. Now today you are the boss here. So in charge, Icy. And there is another one that I want us to talk about. There are some myths that we've been spreading. Yeah. Some says that immunizations, when they give you immunizations, you can become deformed. When they give you this, because they are introduced certain kind of diseases, a whole lot of myth. Is it that you go in there to give diseases consciously for these children, or it's a myth? It's something that is not true.
I think some adverse effects are true, not just a myth. Some do happen, but it depends. Some are genuinely 80% of these myths they are not true. Like the COVID-19, some says it causes impotency, and it's not true. Someone even came for the COVID-19 vaccine and he said he wasn't able to sleep, but now he's able to sleep. It's a coincidence, yes. And as we said, immunization is the act of introducing, let's say, immunization itself is like introducing a disease
Substance.
a disease substance into someone, and there should be a reaction. Every immunization, there should be a reaction that shows that the body's immune system is able to contain this thing. So anytime that disease, that substance was taken into you, anytime you go into contact with the disease, the body mechanism remembers that this particular disease has been here before, and this was how we fought against
Yes,
it.
the body reacted to
Yes,
it.
so whenever the disease comes, the body it reminds the mechanism and it do fight against it. So yes, they say we do put diseases into them, it's true, but not to cause harm, but then to make the immunity
prepare
strong.
itself for that.
Yes, it repels the immune system against future infections to that particular disease.
Okay,
Yes.
and with the disease introduction, let's say that when with the one like you mentioned of the COVID-19, when we took it, some reacted to it, slight headaches, slight fever. So in case when we give the vaccinations to the children and they go home and there is that kind of reactions, let's say the child may be crying, sometimes we say slight fevers and then the pain, what do we do? Do we have to use warm water and put it there where it's swollen, or do we have to sometimes we have to send them to certain areas crying? Do we have to get worried about these kind of actions?
Yes, you become worried depending on the severity or how the baby is suffering. Like I said with the penta, that place can be reddish and it can be swollen. So when you see the place is reddish or swollen, you just, like the warm water you said is really effective, cold compress or warm compress. Normally we prefer you start with a cold compress. When it doesn't go a week or 3 days after, then you go with the hot compress, that is the warm water. And so you can put an ice block inside a towel, then you press the area small with it, slightly pressing it around where you feel there is a pass or something. And when the baby has fever, like baby shouldn't get fever more than 37.8. Or how do you? Yeah, if pediatric. My presenter, I'm asking my presenter. So when the baby has fever,
with the pediatrics, let's say they shouldn't go beyond 37.5.
37.5,
Yes.
37.5. So
probably you can go between, let's say if it's high, you can go, let's say 37.5 to, let's say, but not be up to 38.
38.
So in between.
Yeah. So
That is the normal reaction.
That is the normal
Then
reaction.
You use you expose them, and
Yes.
maybe you have some small acetaminophen.
Yes,
Just keep them,
exactly.
it goes down.
Yes, how you cure fever is exactly how you have to cure the fever and you know how fever occurs when the body is fighting against. Yes, and we've introduced the disease and the immunity is fighting against something. So definitely
there's a
you should get fever. And some babies do have high fever. That is when we ask them to give them acetaminophen, paracetamol.
Yes.
But mothers shouldn't start with the suppository. They should start
The
with
oral one,
They should
please.
start with the orals. Yes.
Yes.
But some mothers, they do start with suppository.
And then I would also say that then when they come to the facilities and then you give these injections, injectable ones, then we need to also educate the mothers on how they should go about the reactions.
We do that very well in Hope Action. Before you give the immunization, you have to tell the mother what's this immunization, each of the 4 immunization, explain to the mother the effects, what the mother should should expect after the immunization. Yes, we have to. In Hope Action, we do.
Okay.
But we
but
don't.
You can't tell about others.
Yes, I can't
So
tell
please,
about
others, you also do
Yes.
the same.
We do. And the paracetamol, because the painkiller, remember the baby is less than 6 months,
Yes.
so it should be 2.5 mils. The mothers, some give 10 mils, 5 mils.
hey.
Yes. And some mothers do rub the area with key soap. Please,
Oh,
let's stop this. it prevents the vaccine from even working, because I've injected the baby with a needle, and there is a hole. Oh.
Yes, there's a
It
break
takes,
through the skin.
yes, and it takes time before it comes back. And you introduce a key soap, and it goes directly inside.
And then
it's agents.
the soaps, they contain some chemicals which are poisonous.
It's poison, so it neutralizes the
drugs that
the
has
drug
been
that,
given.
yes, we've given. So
our
there is
mothers,
no,
we beg.
yes, the baby doesn't build any immunity to the vaccine. And you will say, I've gone for all the 3 immunizations, and like measles. Mother will say, I went for the measles, but my son had measles and he's dead. You ask, and she will tell you, immediately I came home, I rubbed the place with key soap. They said after the key soap, if you do that, the babies don't get fever. That was when I realized then it has gone to neutralize the the potency of the vaccine. That is why. Because the immune system didn't fight against anything. The soap did. And
then still the education should be also be going on with this kind of actions, because when you came for hospital, you came for medications at the hospital, and you go home and you do the otherwise, and
some even bring it. Last Friday, someone came with a soup. Immediately after the immunization, she took it and I said, "Hey, in front of me." It's like killing someone in front of a police officer.
Straight to prison.
Yes. So I took it. I took the soup from her. I didn't even give it to her back.
So please, mothers, when they give the injections, please let's stop giving rubbing the area with soaps and other chemicals. And then with injections, if they give you injections and you start rubbing certain things there, you rather go in there. Either the chemical reactions may cause poisonous to you.
Yes.
Or will reverse the reason why you went to the hospital. And sometimes too, the body reacts in another way, not the medication that it was given to you. The body will rather react to the one that you've introduced new into the system. So please, let's refrain from that. And if you just join us, we are live from Adonfie. We are discussing immunization and its importance. And our dear sister Priscilla Edu Aduma from Hope Christian Medical Center, Public Health Nurse, Senior 1. Here helping us going through, and we are almost done. We are almost coming to the end of our discussion.
Lord, we plead that you plead. Oh, Lord, we plead that you heal.
And she's here to help us wrap up with whatever information that we have. Please, is there anything that you want to tell our people?
Yes, I want everyone should know that immunization is not for babies. We don't have any age range for immunization. Yes, so anytime you hear that there is vaccination going on, everyone should go for it, especially the aged and the immunocompromised patients. We shouldn't leave them in the house and say it's for children. And no, everyone.
With the pneumococcal one, we can even still give it to the 65 years and old and above.
Yes, in the Western world, they do give immunizations for them. I think right after pension, you have some immunizations that you have to take to
influenza vaccine.
Yes, but in Ghana, we don't have money, so we give to the children. And after 5 years, too, the children, they don't have the immunity again. Oh. After 5 years, yes.
But then we believe that the immune system have a bit
yes,
increased.
has been trained.
Yes, so they can fight certain kinds of infections compared to the newborns.
Yes, it's true.
All right, so please, anyone that you'll be greeting? Or I should go and come?
Yes, go.
And please, this is in Pennyfo Kaya. You said the diakosu yani pitri. We are getting close to our discussion, and then it has been a very interesting conversation with your boss when the junior is interviewing the senior.
Lord, I plead.
Certain things. Thank you.
Father.
And you're live from Adonfie. In fact, you'll be leaving this video at social media platforms. At any given time, you can go there and watch. You can also forward it to our various groups that we have for them to also watch. And then we all learn. Because award there, we are always giving birth. And if you don't give birth to your brother, your sister, your mother, or any of your family members is going to give birth. And sometimes you'll be the one to help them understand the importance of what you're supposed to do, the importance of learn the new ones. And then that's why our sister is here helping us going through this immunization. And then the importance of it. He said that it's better you prevent the children from getting infections, and then they may get, sometimes, they become deformed, like the polio that we're talking about. If you don't take the right precautions, you don't take the immunizations, most of them, they become deformed, and then they have mental problems, mental challenges, and a whole lot. So in fact, it's very important that we should start going to the various hospitals, and then right after giving birth for all these shots that we are talking about. And the fact that someone is not giving to the child doesn't mean you should also do the same, because we are not born the same. Even twins that came from the same mother, the same parents, the same day, have different mentality, different immune system. So we don't compare ourselves to others. Do you yourself. What do you need? That is what you need to do. And then our dear sister, please, we have something to add up. So add up. Let's go.
Oh, no, I just wanted to say hi to my pastor, Reverend Johnson Akabraima.
Okay.
And my husband, Herbert Shomatsi Watson.
Akwanta, we are here. All right.
And the last one, my brother, Sexy Joe. Thank you very much for all you do.
Okay. So won't you greet those at your units?
Yes, and those at my units, my backbones.
Yes. They are there.
Yes, all my public health nurses and my community health nurses.
Okay. So I'm also saying hi to you all. Your junior brother is here doing small things. We'll come back home to do the needy.
Yeah.
And also a special greetings to all the staff at Hope Medical Center for releasing such a wonderful woman for us to discuss these important topics. And then always, when we invite you, come with happiness and smile on your faces. And also to our producers, Mr. Andy, and also our counterpart, Mr. Andy's counterpart. I say special greetings to you, and also all the staff at Adunfie, and also at the various health facilities, and special greetings to our matron, Hope Medical Center, and then the medical superintendents, and then special greetings to the administrative staff, and special one to the child health department, especially Dr. Aduma, Dr. Idia, and Sister Joe, and the rest. I say special thanks to you. And those our dear listeners who spend their time and then their data to watch us and listen to us, and also going to share this information. Special thanks to you. And we are here to meet next week, same time. And if you don't hear or hear my voice again, it means we are out. My name is still the same, Isaac.